enter the room.
Hello, and I'm one of the doctors here in this department. Before we start, can you please confirm your name for me?
My name is Emily Thompson.
Nice to see you. Is it okay if I call you Emily?
Well, Doc, I would prefer if you call me Emmett.
Okay, Emmett. Emmett, can you kindly confirm your age for me as well?
16, Doc.
Okay, it's nice to see you, Emmett. How can I help you today?
I'm not sure how to say this. It's embarrassing. I haven't told this to anyone. Doctor, I want to change my sex. I want to become a boy.
Okay, I see what you're feeling, Emmett, and I will surely do my best to help you today. So, can you please tell me more about it? For how long have you been feeling this way?
I felt like this for as long as I can remember. I feel very uncomfortable living as a female. I live as a female, but I really haven't done anything towards transitioning my gender.
Okay, I completely understand. I just want to know a few things from you, and then I will do my best to help you and address each of your concerns. So, would it be okay if we continue with our consultation?
Yes, it's okay. We can continue.
Okay, Amit. So you mentioned that for quite some time you've been feeling that that you don't like to be dressed up as that you don't like to live as a girl. Am I right?
Yes.
So can you please tell me more about your interests? That what kind of things, your daily routine activities you usually enjoy doing?
Well, I just do things that bring me a bit of pleasure, like playing and hanging out with my friends.
Okay. Can I ask you, does your friend consist more of male friends or female friends?
It's generally a mix.
Okay. And can you tell me what kind of colors and what kind of dressings you usually like, you prefer most of the time?
Sorry about that.
Uh, yeah.
Um, Continue, Doc. You think?
Oh yeah, I was just asking that, can you please tell me what type of colors do you enjoy? Do you like more of pinks and pastel or yellow colors, or do you like dark or blue color?
I prefer the dark and the blue colors.
Okay. And also, when as we grow up, during teenagers, there's a lot of puberty changes that occurs. So can you so if for a female they develop breasts and they start having periods, and for males they have body hair and they have this very low pitch voice. So how does all these changes make you feel?
Well, I actually feel distressed by my female body, particularly my breasts and genitalia, and I want to transition and align these with my preferred gender identity. I haven't told my family about this. I don't have any support as yet with my wishes. I've actually tried to visit the LGBT Foundation, and I found their support to be very helpful and inspiring.
Oh, that's really good to know. May I know the reason why haven't you tried to talk to your family or any of your close friends about it?
Well, I'm just worried about how they would react.
Okay, I understand. I just want to know, I would be asking you some questions which might sound a little intrusive, but it's really important for me to know. So, Emmett, can you please tell me, are you into any relationship?
No, dog. Also not sexually active.
Okay, but if in future, if you want to be in a relationship, so with whom would you like to be in a relationship? With which gender will you prefer?
Well, I'm not sure yet in terms of my sexuality. but I do know that I don't want to be a female anymore.
Okay, I completely understand. So thank you so much, Emmett, for answering all my questions. So based on our discussion, okay, I just want to quickly examine you. I just want to check upon your observations and just do a general physical examination. Uh, so by any chance, do you have any health conditions running?
No, I don't have any medical conditions.
Okay, thank you so much, Emmett. So based on our discussion, it seems like you're having what we call as gender dysphoria. Have you heard about it before?
I think I've read a bit about it, but I would appreciate an explanation from you.
Definitely. So, Emmett, gender dysphoria is a discomfort a person experiences when there is a conflict between their gender identity and their sexual orientation. They usually feel that there is that they are not in a correct body. So that's what you've been experiencing right now. So what I'm going to do for you is I would be referring you to the camps, that
Two
is
minutes
child and
remaining.
adolescents health support group. So over there, they will be you will meet a group of doctors, which includes pediatricians, psychologists, psychiatrists, gender identity specialists. So each one of them will come and assess you, and they will see how much you are ready to be into this. Uh, you're you're very they'll make sure that you're very much mentally and physically ready to be in a different body. So so far, are you able to follow me, Emmett?
Yes, so far I think I understand what you're saying.
Yes, so over there, once you meet the people, they will assess you, and so most probably, once they are assured that you can comfortably be in this transition, so the treatment options will include that they will firstly put you on some hormonal treatment, and then they might offer you some surgical treatment as well, and some cosmetic treatments. And but I need to assure you that this entire thing is going to be very time taking and a very long process. So you will be offered all the psychological support as well. I would like to also offer you some leaflets regarding all the support groups and about camps and gender dysphoria and everything. So you can have a complete read about it. And at any moment, if you're feeling overwhelmed or low in mood, please do let us know immediately. We're always here to help you about it. And also, Emmett, I would like to suggest that it's better that you try to open up with your family and friends, because we believe your friends and family are a very big support system throughout this journey. So, would it be okay for you if you discuss? If would it be okay for you to follow all these advices?
Yes, I'll do my best.
Move on to the next station.
Thank you.
Good job, Dr. Mercy.
I hate this scenario. To be honest, this is the most hated scenario by me. I don't know why. Because the data gathering is so confusing in this scenario.
Yes, absolutely. I can understand that. Yeah, but you did a great job. So I have to say. So, let's talk about gender dysphoria. So you mentioned so is sexual orientation the same as gender dysphoria?
No, actually, both are different.
So you went a lot about, you mentioned in the explanation also something about sexual
Yeah,
orientation.
actually, I shouldn't have mentioned the line sexual orientation. I should have said that there's a conflict between a gender identity of a person. Basically, he feels like they are not they have like a gender conflict, like they are in a wrong body. They
Yes.
think that they are like what they were the gender which was assigned to them at birth. They are not comfortable in that gender. They wish that they were in the opposite gender.
Yes, absolutely. I completely agree. So yeah, that's exactly what this entire focus should have been towards. So what are the issues that you would expect in a person who is having such dysphoria? Like what are the things that you need to ask? Like what are the important points that you need to highlight?
Actually, I realized it later that I should have asked about the mood. That's really important
You did.
because this. Good
eventually safety net it
way.
is. So that's a good way to actually handle that. Not bad.
Exactly.
Otherwise,
Yeah.
what are the important things that you should think about when you're talking to a 16-year-old person who's thinking that they are uncomfortable with their body or themselves? What are the main things that would worry you about this patient?
It's actually mainly all the psychological stress that they might go through because of it, and maybe they're worried about being others finding out about it, being bullied, and
Exactly, you're getting there.
yeah.
Absolutely. So that's exactly what you need to ask. Like, are you being bullied? Do you have any stressors that I can address? Right? And
Right.
what is another important thing? Like, if the person feels they're bullied, they would do something about it. Don't you think so? So
Right.
you need to think about, what are the steps you have taken, towards, this identity crisis that you have been feeling. Like, just it's an open question. Like, that's what you are closing your questions into asking very specific things, which may or may not be relevant. It's like a shot in the dark. You don't know. So a
That's
good way
true.
to ask it is like an open question, like what are the steps you have taken towards, feeling more appropriate in your body? Something along those lines. Like, what is it about your body that is worrying you? Do you understand? So they'll actually
Right.
ask you about the biological factors that is worrying them. So, start with an open question. So, this is the problem that I'm understanding from this station with you is that, you're closing your questions into very specific aspects. You asked at one point, you asked about the color. Like, do you think that is relevant? Like, how does that
No,
matter?
that's no, that's not actually very
Or
relevant. Yeah,
even
I realized that because yeah, that's the thing. I get really confused. I mean, I know, but it's just that I get very confused that from where should I actually start?
Yeah, see, that's why you actually went and closed the question so much that there is nothing more that they can talk about, right? So
That's true.
maybe,
Yes.
even asking about the company that they keep, that's also like, what difference does it make? Like, how does that help you in your management or understanding a little bit more about this person? Right? Ask about support system, like who live with your family, are you close to your friends, have you revealed it to anyone, why haven't you revealed to anyone? So what you're trying to understand is their disposition, like why are they feeling this way, what have they done about it? Because if they've actually illegally gotten medications, you need to understand that issue. That is a big issue. What if they're taking testosterone without prescription? Right, this person very clearly said that I'm not happy with the way I look. I feel very uncomfortable having breast and genitalia. So what have you done about it? Have you done anything towards it? Have they mutilated themselves in a certain way? Hey, that's what you need to understand. Like, how are you safeguarding this person? What are the dangers and the risks this person would be exposed to, right?
Mm,
Understanding the fact that this person is definitely, confused and, they want to, understanding, giving them a direction towards helping them develop. So maybe, so they must have mentioned that she mentioned that I did go into the LGBT website and I checked it out. Found it helpful. That's a positive step. You want to encourage that step. Instead, if you find that there is a negative step, you need to uncover them. You need to understand, have you been doing anything that you shouldn't be doing? Like, taking medications or, mutilating themselves. Those are things that you would want to find out and advise against. But then if you see that they are actually reading up and about it, you want to encourage that. So even the positive and the negative steps you need to understand, right? On top of that, what is the most uncomfortable thing about being, female? Like, definitely, what is it? The biological factors, the social aspects of going into a public restroom or, being uncomfortable around other women. Yeah, those are the things that you need to understand so that you can give management for that. Because the questions that you ask, there is no management you can give about it. If you think about
mm.
that, you know.
Right, exactly.
whenever you're thinking about asking a question, think about what can I manage when when I get an answer for this, right? So that's definitely a good way to, understand those things. So a little heads up about this case. Definitely, sexual orientation is also important. Like, have you, understanding how much have they explored into their identity? The dysphoria, also the sexuality is also important to understand. If they're practicing safe sex, then we can also safeguard against that as well, right? So, yes, I'll quickly take you guys through the performance. Sorry. Oh, thank you, Dr. Natasha. That was a really good performance. Yes, Dr. Natasha, you have a question. Please go ahead.
Okay. Sorry, I haven't read this topic, so I just want to get a bit of clarification so that when I go back, when I do read it, I understand.
Please
You were
go
saying
ahead.
that she described it as gender dysphoria, but it's actually not. So in this case, what exactly is the patient dealing with?
Is gender dysphoria actually? I said there's nothing about sexuality, the orientation. She was kind of focusing on the orientation a little bit and saying that, that is an aspect of gender dysphoria, which it's actually a different, mm, thing altogether. It's a different concept altogether. Dysphoria is the morphological features that you are not satisfied with. Orientation is a little different from that. Right. So you do want to understand the overall, identity of this person. So you do want to ask about the orientation a little bit, just to safeguard them from any, bad practices such as not using safe sex or any questions they may have, you can answer them. So let's talk about gender dysphoria. So transgender assessment is a very interesting topic, and it does. I mean, especially it gets tested very often in the PLAB, because you are supposed to be culturally aware. You can't be discriminating on the basis of sex, gender, orientation, right? So dysmorphia, by the name itself, it means dys means anything against, and morphia, morphology. So basically, they are not satisfied with the biological gender. So one thing, so initially definitely confirm by the name. You ask the name, right? So confirm if they are a biological male or a female, right? And then start talking about it. Do you currently live your life as a male or a female? That is a very important question. Like, how are you living your life? Do you feel uncomfortable in your gender? How long have you been feeling uncomfortable in your gender? Right? Those are the main questions you need to understand about this person, right? And then, talk about, what are the aspects that make them feel uncomfortable, right? What are the steps they have taken towards making them more comfortable, right? So this is a couple of questions that you can actually ask, right? Ask about their social support group, because you definitely want to understand, how are they coping with this identity crisis that they are having. Have they told this to anyone? If they have, are they getting bullied? Has anybody told them anything negatively? Because after understanding all this, when you're giving the diagnosis, you will be giving this along the lines, what you are experiencing is something, it's not suffering, so it's what you're experiencing is something called gender dysphoria. Explain what that is, right? So it sounds like you've been feeling a deep discomfort or a mismatch between how you feel inside and the gender you were assigned at birth. This feeling is known as gender dysphoria. It simply means that your inner sense of who you are doesn't align with how your body or others might label you. This sometimes may it's something many people experience, and you're not alone in this. There are respectful, supportive pathways available, and we can talk through what help or guidance might be most useful for you right now. So that's the main thing, right? So understanding, you have to normalize the situation for them. You have to encourage them in living life the way that they want to. Right, those are the important managements that you have to understand. So you have to understand how are they living life right now, how to encourage this. So this person said, I prefer being Emmett, right? So definitely start calling yourself that. There are legal ways that you can even go ahead and change your name as well, right? So before even going into the transition part, there are so many things that they have to do before transitioning. I mean, even the medical and the surgical transformation before they happen, they have to start living life and getting used to it. So you'll be offering them support that can, make them comfortable and normalize the situation for them, mainly. So you will be, as you very well mentioned, so the gender, the GID clinic, the AMS, that's very good, right? So, definitely those are the first steps that you need to take for actually reducing the psychological stressors, like very well, very nicely mentioned by Dr. Mishi, right? So you need to reduce the psychological pressure. You need to make sure they're confident in what they have chosen to be. And then once they have made that decision, they can go forward with the medical and surgical treatments in the future, right? So they just need somebody to talk to, somebody to explore what they're feeling, understand a little bit deeper into how they are feeling, right? So you have to manage in those terms. So a couple of management points are also written over here. And emphasize not to take any steps like medication or any mutilation without talking to anyone. And mood and anhedonia, depression is something that you should definitely look out for in these cases. Yeah. So anybody, any questions, any doubts? Anybody has anything to add? Yeah, no? All right, let's quickly look at the performance in that case. All right, so confirm the birth, ask for preferred name and pronouns. Clarify the presenting concern by asking what prompted the consultation and how long the patient has been feeling this way. Explore duration of feeling like a different gender. Inquire about disclosure to others and support received. Assess if sexually active and partner's gender. Establish the main concern regarding the gender identity. Right off the bat, you need to start doing that. Understand what exactly are they worried about. Like, what is it that best is, could you please explain more? That's the perfect opening question that you can start with. Definitely go with open questions. Assess feeling about body and any dysphoria. Past medical conditions or medications that the patient is taking. That's also very important. Depending upon that, the further treatment will be planned for these patients. Take sexual and menstrual history, including sexual activity, use of contraception, menstrual irregularities, or any related distress or discomfort. This is very important because, why is this issue arising? Is it because of any, biological dysfunction that they are facing? Do they have any problems with, as a normal functioning as a woman, right? Just understand that a little bit. Inquire about steps taken towards transition, such as name, pronouns used, clothing changes, or online social, disclosures. So this is the thing I think you were trying to ask, in a way by saying, what are the steps, like socially, what have they tried doing, be it clothing, social media. Nowadays, everybody, they have to announce everything. Anything, in fact, they'll just probably log on to any of their social media platforms and just post it, right? So that's also one way to understand how much of it have, how much of the transition process have they taken, right? Assess current living gender and any steps taken towards preferred gender. Evaluate any current stress, anxiety, or depression. Assess the social impact, including bullying, discrimination, school experience, or any difficulties using gendered spaces like toilets, right? So yes, those are very important points to cover. All right, so let's look at management. Encourage understanding gender identity and exploring feelings. Offer leaflets and pamphlets about support. That's very good, Dr. Mishi. I think you got that, got that handle of offering leaflets and, safety netting. So good job on that. I explained the diagnosis using accessible language, describe gender dysphoria as a recognized and valid experience without, pathologizing it, right? Discuss possibilities of hormonal therapy and surgeries. I think that is something that you shouldn't completely focus on, because right now your main, treatment would be actually referring them to for any psychological and mental health. So in this case, CAMS, that was very nicely referred by you, and as well as the gender dysphoria clinic, right? So definitely those are two things that you have to mention in this case, and especially identifying that this is, minor, like this is a child who is 16. You can actually offer them CAMS over here, right? So discuss possible side effects of medication treatment like hormone therapy, such as fertility impact and physical changes. So also, even though you're talking about medical treatments that you can avail in changing your gender, you also have to safeguard them from it. You're not trying to instill an idea. You are telling them that that is a process that can be followed, but make sure that this is done under the guidance of a doctor. Otherwise there are a lot of side effects and harmful impacts that can happen, you can have in your life, right? So definitely mention it in that sort of a way, right? Acknowledge the patient's feelings and concern, assure about confidentiality and support. So usually in these cases, they don't really open up right away. Dr. Natasha really opened up right away, but usually they, kind of beat around the bush, and they go about saying, I don't know how to express myself. I haven't spoken to anyone about this. I'm not sure if if this is the right place I can talk, if you're the right person I can talk to. So in those cases, definitely, offer confidentiality. Before that, try to explain your role, of who you are, like who you are for the community, right? You are here to help them and provide them with support if, if they are feeling distressed about anything, and, whatever you say would be between you and my team, until everyone is safe, right? So do mention those important points as well. Inform about legal transition pathways, including changing name, gender markers on ID card, ID documents with proper guidance. Provide information on support groups and resources. I think you did this point, so yeah, wouldn't penalize you much on that. I'm sorry, I didn't mark that. All right. So interpersonal skills. So this is one place I needed to tell you, talk to you a little bit more on, because in this entire conversation, it seemed like it was a one-sided conversation. When you came to management, you were not allowing her to speak. You need to ask her specifically, are you with me? Is there anything, more I can add? And, that's a conversation. So whenever you feel like you are talking more than a minute or two, that means the station is not going well for you. You just
I understand.
straws. Yeah, you need to, you need to have a conversation, right? So that's exactly what you were lacking here, right? Allow the patient to ask questions and express their concerns, right? ICE, definitely. Simple language and avoid medical jargon. Yeah. Provide a thorough patient-centered answer. Yeah. All right, guys. Well, thank you, Dr. Mishi. That was gender dysphoria. I know this is one of the most scariest cases. The LGBTQ cases are.
Indeed, this particular one is for me, especially I struggle in this a lot. So I do feel like I need to practice more on this particular scenario. Thank you so much for doing this scenario with me today. So I know where I have to work.
Absolutely, Dr. Mishi. Yes, absolutely. And you can definitely, guys, if you want to try out this case, you can definitely try it out on the workbench. You can either practice with your partner like the way we just did, or else you can also practice with the AI, where you can have a conversation. If you don't have a practice partner, you can have a conversation with the AI, and you can have the checklist marked out by the conversation that you have had. So everybody that is joined online, just want to take you through the AI practice more really quickly, where you will have a minute of begin and a candidate information to enter. So you have 1.5 minutes, and then either you wait for the 1.5 minutes to finish, and then you can directly enter the room, or else you can just click on enter the room.
Enter the room.
Where you will actually meet your AI simulator. Hi, my name is
Dr. Ann?
Okay, just quickly taking you through the patient GPT. So, yes, so you can actually have a conversation with the AI where, you know, so I can see, Emily, you've come with some concerns. Can I please confirm your name and age? So,
Sure. My name is Emily Thompson and I'm 16 years old.
and how may I address you, Emily?
I feel Emmett is my real name.
Sure, absolutely, I understand that. So Emmett, I can see that you've come with some concerns. Can you please tell me a little bit more about them?
I'm not sure how I can say this. It's embarrassing. I haven't told this to anyone.
Yeah, so that is your patient GPT, guys. So either you can actually run it for 8 minutes, or else you can just end the conversation. After you end the conversation, you can get an evaluation by the AI, and this will help you understand, you know, what are the aspects that were covered and what were the aspects that were missed by the conversation that you've had. And yeah, we'll wait for a little while. I think the evaluation is complete. Yes. So as it is in the exam, you have data gathering, management, and interpersonal skills. And as you can see, you know, all the aspects that were covered, partially covered, and missed have been highlighted so that the next time when you practice, you can actually have a more experience. So every time you practice, it gets logged into the performance dashboard where, you know, every day that you practice comes in by the date and the time and the entity that you've practiced. If it's a human partner, it will be a human silhouette, or else it will be a robotic face if it's the AI. So do check it out. We have a couple of cases which are free, and I'll just post the link, you know, on the chat, and yes, definitely have a go at it and do let us know.